Thank you for the opportunity to present the updated results of the IDH1 inhibitor Ivosidenib, formerly called AG120, for patients with IDH1 mutated AML. And as a bit of background, IDH1 mutations occur in about 6 to 10% of patients with AML, so it's certainly a smaller subset, but a sizable one where this is definitely an exciting and an encouraging therapeutic option. The results that are being presented today are the entire study cohort of 258 patients looking at safety. Overall, the oral kind of once daily agent was found to be very safe and well tolerated, primarily grade 1-2 GI side effects, some QTc prolongation that was easily remedied by discontinuing other QTc prolonging agents, and in some cases of differentiation syndrome. So we're learning a lot more about IDH inhibitor-related differentiation syndrome, and that was seen in about 10% of patients, but well managed with steroid therapy and hydrea and diuretics as needed. In terms of responses in the relapsed refractory patient population, which was about 125 patients of the whole cohort of 258, in that relapsed refractory AML population, patients had received a median of 2 prior cycles, had a median age of 67, so it's an older patient population. And in that group, the primary endpoint was CR/CRh responses, which happened in 30% of patients, and a true CR happened in over 20% of patients, 21.6%. And responses were durable. Responses, CR/CRh responses were sustained for a median of about 8 to 9 months. And in terms of overall survival, appears to be improved significantly from the kind of anticipated historical survival times of patients with relapsed refractory AML, where we saw overall of all patients treated a median overall survival of about 8 to 9 months, but in the responding patients even more favorable, and in the patients who had achieved a CR or a CRh, the primary endpoint, a median overall survival time that hasn't been met with a median follow-up time of over a year on study. So really encouraging results. Patients are tolerating these therapies well. Again, it's oral outpatient therapy. And some correlative work and subset analyses we've done have looked at the incidence of transfusion independence. So of patients who came in requiring blood or platelet transfusions, about over a third, up to 39% of them, became either red cell transfusion independent or platelet transfusion independent. Which is a huge quality of life benefit for patients that are frequently coming into the clinic more than once a week to get a transfusion. So this is significant, as well as a decreased incidence of infections and grade 3 febrile neutropenia in responding patients. Again, just really kind of showcasing not only the kind of true effectiveness, but also the improvement in patient quality of life with this therapy. So it's exciting, and we'll see what the future brings. They're moving it now into the front line, and there are ongoing studies in combination with standard therapy, with hypomethylating agent-based therapy, and a couple other ideas on the road to try and make this a curative option for those patients with IDH1 mutations.